Welcome back to the What's in Your Head podcast. I'm Pete Schultz, doctor of physical therapy. In over my 20 years of practice as a physical therapist, I've seen hundreds of people suffering from headaches. The one thing that is very clear to me with this population is that no two headaches are identical. Each person's experience of symptoms are unique to them. Today we're breaking down the different types of headaches because migraine, tension headaches, neck-related headaches, post-concussion headaches, sinus headaches, and medication overuse headaches may all share the same name, but they don't share the same pattern or experience. What they often have in common is that they're not signs of damage, but they're signs of a complex and hypersensitive system that's trying to protect you. In this episode, you'll learn how to recognize different headache types. And once you can understand the characteristics of a particular headache, you're one step closer to changing your nervous system and the patterns that contribute to the headache. I'll also guide you through a short progressive muscle relaxation exercise, a simple tool to help calm tension in the body and support headache relief. If headaches are part of your life, this episode will give you clarity and a more complete way to think about what's happening in your head. Today, we're going to dive into headaches. It's important to understand that not all headaches are the same. We get a lot of people that come into the office and report having migraines because that's what their mom or their cousin had. Oftentimes, it's not actually a migraine. It may be a tension headache. It may be a cervicogenic headache, or it may be a different type of headache. All of these are subtypes, and they're treated very differently. And just because something worked for a friend or family member, it doesn't necessarily mean that it'll work for you. Once we understand that there are many different types of headache, it becomes much easier to manage your symptoms and to know where to begin. Although I'll be sharing treatment concepts and tools, everyone's situation is different. This podcast is meant for educational purposes. If you're dealing with headaches or other symptoms, it's important to work with your own healthcare professional who could provide individual guidance. Now, there's a lot of research about medication and supplements that can be very effective for headaches. As a physical therapist, I focus mostly on the non-pharmacological side of treatment, like physical therapy interventions, exercise, posture, breathing, self-regulation, biofeedback, mindfulness, lifestyle modifications. I'm not anti-medication, as oftentimes they're necessary and to help people function. However, I do come across a lot of people that are unable to take medications for various reasons. Maybe you're pregnant or you're trying to have a child. This is a very common reason for people with headaches that are looking for non-pharmacological treatments for headaches. Or maybe there's a religious or cultural reason. So there's a lot of reasons that people can't or don't necessarily want to take medications. I just want to let everyone know there are other options, and there are options for treatment in the non-pharmacological world. Some of the non-pharmacological treatments for headaches are very powerful ways to calm down the headache. And these treatments include exercise, sleep modification, massage, breathing and relaxation techniques, biofeedback, mindfulness, lifestyle modification, and stress reduction. All of these have definitely are in the research and have shown to decrease frequency and intensity of headache and migraine. Headaches are complex, and everyone has a different, unique experience with their own headache. It's really important to know that no two headaches are alike. What you experience might not be what someone else's experience, or a lot of people have headache. Some people have migraine. Some people have other types of headaches. It is important to know the type of headache or the type of symptoms you're experiencing to figure out what the best treatment approach could be. A lot of people come in and just call their headaches migraine. Now, migraine is a specific subtype of headache, which we're going to discuss in depth, but not every headache is a migraine. When people understand their headache type, they're not going to be as scared. They have more information, and there's a lot of research out there that shows the more information you have, And the more educated you are, the less scared you are, and the more likely we could start healing. First thing I'm going to discuss is in determining the classification system of headaches is primary versus secondary headaches. So the way we break down headaches is primary and secondary. And what a primary headache is where the headache itself is the condition. There's no tumor, bleed, infection. There's really no structural damage. The headache itself is the issue. So you might have gotten imaging, you've done a bunch of tests, and the doctors or your healthcare professionals haven't found any significant structural findings. In this case, your nervous system is generating the pain. Then you have secondary headaches. Now, secondary headaches are caused by something else that is structural. It might be caused by a tumor or an aneurysm or bleeding, a certain medication you're taking, an infection or meningitis, or an environmental factor like carbon monoxide or mold or some kind of trauma. These are conditions or disease processes that contribute to or cause a headache. It's important when you're having significant headaches, you definitely want to go to a doctor. You want to go to a healthcare professional, get some of these things ruled out. And then a lot of times people who have been experiencing, most of the time, people who are experiencing persistent or chronic headaches, it's not due to structural damage, and it's a primary headache. Headache itself is the issue. Scans are normal, and your headaches are long-standing, it is almost always a primary headache disorder. And we can improve those primary headache disorders with proper treatment. First headache disorder we're going to talk about today is migraine. Migraine is a neurologic disorder involving the brainstem and the trigeminal nerve pathway, which innervates the eye, face, and jaw. Trigeminal nerve is one of your cranial nerves, and it innervates the areas, the sensory system in your face, eye, and jaw. But there is a strong genetic component. If a family member or especially a parent has migraine, you are 4 times more likely to have a migraine if your parents have a migraine. It often begins around puberty, and it changes throughout the course of your life. Some triggers include stress, hormones, sleep, posture, screens, weather, environmental factors, foods. Now, the triggers are a little controversial because sometimes there are food triggers and people are trying to identify triggers, and sometimes there's not triggers. Sometimes you just get a migraine. But we do know that with migraine, there are things you could do like getting sleep and making sure you're drinking enough water, making sure you're getting exercise. And some of these lifestyle factors have been shown to decrease the frequency of migraine. Now, there's different types of migraine. An ocular migraine is when you see there's some kind of visual disturbance. You might see wavy zigzag lines, or you might see stars or some kind of flashing lights. So that's an ocular migraine, and it doesn't always have to turn into a headache or be associated with a headache. Sometimes that's the symptom itself, and sometimes that will progress. That's an ocular migraine. We could also consider that an aura. An aura is these visual sensations or these visual disturbances that happen prior to getting a migraine. Then there's vestibular migraine. So vestibular migraine is a migraine that doesn't necessarily have a headache, but instead of having a headache, you're getting vertigo or you're getting dizzy symptoms. Acts like a headache, but instead of having pain or headache pain associated with it, you're going to feel dizzy or vertigo. These are considered vestibular or atypical migraine. There's also something called hemiplegic migraines. You could have a migraine and you could have similar symptoms to a stroke. You could have slurred speech, or you could have some loss of muscle strength or dexterity in your extremities, and it's temporary, and those are hemiplegic migraines. Some common features of migraines are throbbing on one side of the head or some kind of pressure It's usually on one side of the head, but it can change sides. You have light and sound and smell sensitivities. You're sensitive to touch. Oftentimes, people with migraines, they don't like to wear things touching their face or touching their head. They're uncomfortable with the pressure of the glasses or a hat. It can be associated with nausea and vomiting. There's usually a visual aura. You can have vertigo and dizziness with a migraine. There's often neck and jaw tension, and people experience this brain fog sensation. The symptoms usually build over the course of a few hours, then they peak and then gradually fade. And you're usually left with these mild symptoms that could last for days. Over the course of a migraine, whichever type of migraine you have, they usually will build over the course of a few hours, peak, and then they gradually fade, and then you're left with these low-level symptoms that could last for hours or days. There are a lot of medications that are used for migraine, which we're not really going to discuss today, but there's a lot of really good headache neurologists that I work with that have a lot of good treatment options on the medication side. But when you have an active migraine, there's not much besides some medication and rest to bring it down. When it's really intense, when you have that intense pain, it's hard to bring down that pain. But once it settles a little bit, there's a lot of things you could do on the non-medication side. When it's low-level headache, you could do some cardiovascular exercise. You could do self-regulation exercises, biofeedback, progressive muscle relaxation, which we're going to go into later today. We're going to go do a 5-minute progressive muscle relaxation exercise. Mindfulness and even vestibular therapy has been shown to decrease the frequency and intensity of migraine headaches. Next, we have tension type headaches. Now, tension type headaches are probably the most common type, definitely the most common type of headache that I see. Tension type headache, people usually describe it as a tight band that wraps around the head. They feel pressure in the forehead or temples. They feel a squeezing. You could have neck and shoulder tightness. And it's usually a mild to moderate headache. It's not as intense as your migraine or your cluster headache. It's driven by chronic stress, shallow breathing, jaw and shoulder clenching, teeth grinding, excessive screen time, poor sleep, poor posture, emotional strain. A lot of these things is stress. A lot of times stress will be the main factor or driver in your tension type headache. In this situation, the nervous system never fully relaxes and these muscles stay tight and guarded, and it results in this type of headache. Same thing on the medication side. Your doctor may give you some muscle relaxers or something for the pain, but on the non-medication side, I really like a progressive muscle relaxation exercise for a tension type headache. That's where you tense muscles and you let them relax. Also, mindfulness exercises, posture exercises are good, and neck strengthening or posture exercises are always good for these type of headaches. Then we're going to talk about cervicogenic headaches. Cervicogenic headache, it's like a tension headache, but it's related to the cause is related to the neck. These headaches often start in the neck or the base of the skull, and they travel up to the head, and they're usually on one side, and they call them a ram's horn distribution. A cervicogenic or neck headache is on one side of the head typically, or in the back of the head. It's worse with movement and includes a lot of neck stiffness or limited range of motion. With this type of headache, there's usually a significant limitation in range of motion, and that may be due to arthritis, or it may be due to some degenerative changes in the neck. It may be due to a neck strain or a neck injury, and it could even be due to stress or tension. The recommendations for this type of headache are physical therapy to improve neck range of motion. Your physical therapist might do some manual therapy, or a chiropractor might do some manual therapy to improve your range of motion of your neck, improve the strength of your deep neck muscles, your deep cervical flexors. So these deep neck muscles with certain exercises could get stronger, and improving your posture, improving neck range of motion, improving neck strength, getting your neck to move better, and working on your posture usually helps these types of headaches. We also do progressive muscle relaxation, biofeedback, and any of these stress reduction techniques. The next type of headache we're going to talk about is occipital neuralgia and trigeminal neuralgia. These neuralgias are inflammation of the nerves. These are very specific types of headache. An occipital neuralgia is usually focused on the base of the skull area. In the base of the skull, if it's really sensitive to touch, most of your pain is located in the back of the neck, base of the skull area. It's usually more one side than the other. There might be some numbness and tingling in the back of the head or the scalp. This may be an occipital neuralgia. There's also a trigeminal neuralgia, which is very similar symptoms to the occipital neuralgia, but instead of the base of the skull, these symptoms and hypersensitivities are along one side of the face. They'll act very much like the occipital neuralgia, but the trigeminal neuralgia follows that trigeminal pathway, which is on the side of the face, eye, and jaw. Now, these neuralgias are usually, the doctors will sometimes treat them with nerve blocks and certain medications. As far as the non-pharmacological or non-medicine, again, some physical therapy to improve neck range of motion and improve posture. And there's also self-regulation techniques, biofeedback, and all these. The next type of headache is new daily persistent headaches. New daily persistent headache is very uncomfortable. The headache starts at a specific day and it just never turns off. This is your nervous system goes into this protective state and it just doesn't shut off for a prolonged period of time. This usually starts after an illness or a virus, maybe a stressful life event, a concussion, or sometimes there's even no clear trigger. It could last months to a year, and sometimes it goes away spontaneously. The nervous system learns this danger pattern and it fails to reset. It's not damage. This is a protective mechanism from your nervous system. And again, it's a long-lasting headache, low level. It's not as intense or severe as a migraine or cluster, but it's really uncomfortable. And what I find with this type of headache, a lot of education on headache and pain, breathing exercises, self-regulation, mindfulness exercises, posture exercises, all in that similar realm. The next headache we're going to talk about is the post-traumatic or post-concussive headaches. After a concussion, you have these neural connections that are temporarily delayed and inaccurate. Even as the brain recovers from a concussion, oftentimes there are these lingering headaches. Symptoms can act similar to migraine or have other presentations with parts of migraine. This reflects a nervous system sensitization, not an ongoing injury. You've had this concussion. I see this a lot with people with concussion. You've had a concussion and then you have this lingering headache, or you have episodes of migraine after which you may not have ever experienced a migraine before. And this is the neural pathways in your nervous system. It's just still sensitive and it's still sensitized. And it's really uncomfortable and it's really frustrating. And a small percentage of people have these lingering headaches after concussion with no structural damage. It's really important for these people to get these under control. There are certain medications that are prescribed sometimes, but things you could do on your own is definitely self-regulation exercises, breathing exercises, calming, anything that's calming to the nervous system, any type of stress reduction exercise, some cardiovascular exercise to help your autonomic nervous system. The symptoms associated with these headaches are, a lot of people will identify head pressure, light sensitivity, dizziness, brain fog, also neck pain. These usually happen after some kind of trauma, either a head trauma or an accident or something like that. And they're in the classification of post-traumatic or post-concussive headaches. The next type of headache is probably the most painful type of headache, called a cluster headache. They're called cluster headache because they occur in cycles. And it's interesting with these type of patients or these type of headaches, they often happen at the same time of day, kind of like an alarm clock. They're super intense. People describe them like an ice pick going through their eye. The pain is usually behind the eye, and it's very debilitating. It's very uncomfortable. The pain can wake you up from sleep. You have this severe pain behind one eye. People describe it like an ice pick. You might get tearing in that eye or nasal congestion and agitation. The attacks last 30 minutes to 3 hours, and they could occur for days, weeks, or months, but they usually happen together at several times a day. Now, this is rare. It's not that common, and it is very severe, and it usually requires medication. There are other things you could do in the breathing relaxation. And I just want to get the point across that breathing, relaxation, stress reduction, posture, it's good for everyone, right? That's something that you should incorporate in your life. If you have headache, if you have any type of headache, that's always the first thing that I'm going to say. Do you do any breathing exercises? Do you do any self-regulation exercise, any mindfulness? That's a very easy thing to change in your life or add into your life that could make a big difference. Then we're going to talk about sinus headaches. Now, sinus headaches are interesting, right? Some people have sinus infections where maybe due to allergies, you have tightness in it, but most of the time, sinus headaches or these really intense sinus headaches are actually migraine. So what we're finding is people who have experienced really intense sinus headache, that's usually a migraine. Sometimes if you do have a lot of congestion in your sinuses and have a sinus infection, those are treated with antibiotics or how you would normally treat a sinus infection. The trigeminal nerve supplies the sinuses, teeth, jaw, face, and forehead. And when this trigeminal nerve gets sensitized, it could produce pressure, congestion sensation, and facial pain, even when sinuses are clear. Is this more of a migraine? Oftentimes, we could consider this one a migraine and not a sinus headache. Then we have medication overuse headaches. Medication overuse headaches is an interesting concept because this is actually where a medication you might be taking for headache actually causes the headache. It's due to frequent use of pain medications, usually over-the-counter medications, also these caffeine-containing medications. So what happens is you take this medication for your headache goes down, and then when that medication wears off, there's a rebound effect where the headache comes back, and it comes back a little bit stronger. The recommendation is usually not to take, if you're having persistent headache, go seek some help from a medical professional or a healthcare professional to get on maybe a right medication, because taking over-the-counter medications can often lead to rebound headaches or medication overuse headaches. Okay, so those are some of the most common headache types that we will see at the office. And there's a lot more headache subtypes and classifications, but those are some of the common ones you'll see or hear about. And again, I just wanted to touch on the non-pharmacological treatment of headaches. I think these treatments or these exercises, activities could help everyone, and they could help most of these headaches. Some of the most powerful ways to calm your headache symptoms are exercise, making sure you get enough sleep, your nutrition, making sure you get enough hydration, some physical therapy or chiropractor or massage techniques, breathing, relaxation, mindfulness exercises, biofeedback, any type of self-regulation exercises to work on your autonomic nervous system. And then, just lifestyle changes, stress reduction. Before we get into today's tool, which is progressive muscle relaxation exercise, I just want to let you guys know that if you found this episode helpful in understanding a little bit more about headache or helping you with your pain or dizziness, if you could just follow the podcast or share it with someone who you think it could benefit. Before we get started, I want to explain what we're about to do. The exercise is called progressive muscle relaxation. It's a simple technique where we gently tighten certain muscles and then we let them relax. The reason this works is because a lot of people with headaches are carrying tension without even realizing it, especially in the face, jaw, shoulders, and hands. There's actually good research showing that progressive muscle relaxation can help reduce both frequency and intensity of headaches, and it's been shown to lower muscle tension in the areas that commonly stay tight when headaches are present. As we go through this, there's no need to force anything. We're just practicing noticing tension and then giving your body a chance to let go. I'll guide you through eyebrows, jaw, shoulder, and fist, so just follow along at your own pace. Quick note before we start. If you're anything like me and tend to listen to podcasts while driving, might be a good place to pause. It's best to do this exercise when you're in a safe, comfortable space where you could fully focus. All right, so I want you to sit in a nice, comfortable position with your feet flat on the floor and your back resting comfortably against a chair. And I want you to take a few deep breaths. So a nice breath in through your nose and a long breath out through your mouth. Good, let's do 2 more just like that. A deep breath in through your nose and a long breath out through the mouth. And when you breathe out through the mouth, you want to feel your muscles relax. So 1 more time, let's do a deep breath in through the nose and a long breath out through the mouth. Good. So on this next breath in, what I want everyone to do is raise your eyebrows up towards the sky. So raise your eyebrows up toward the sky. I want you to take a deep breath in, hold it, and then exhale and relax all the muscles of your face. Great. And let's do that 2 more times. So raise your eyebrows up towards the sky. Take a deep breath in, hold, and then relax all the muscles of your face. And just feel all the muscles of your face and all the tension in your face relaxing. Let's do that 1 more time. Raise those eyebrows up. Deep breath in and hold. And then a long exhale and relaxing all the muscles of your face. That was great. So that releases tension in all the muscles of your forehead. And now we're going to move on to the jaw. So now what I want you to do is gently clench your jaw, probably about 10% of what you could do, and then take a deep breath in. And when you exhale, relax all the tension. So exhale and release all the tension in your jaw and let your mouth open slightly, relaxing all the muscles around your jaw. Again, let's clench your jaw. Take a deep breath in. And then relax all the muscles around your jaw and all the muscles in your face. 1 more time. Clench your jaw. Take a deep breath in. And then exhale, relaxing all the muscles of your face. Let's take another few deep breaths, just without any relaxing, trying to relax all the muscles. So deep breath in through the nose. And then we want to relax all the muscles of your body on the exhale. And we'll do 2 more, just like that. A deep breath in through the nose. Exhale, relaxing all the muscles in your body. And then 1 last time. Deep breath in through the nose. And exhale, relaxing all the muscles in your body. Now we're going to move on to the shoulders. So I want you to raise those shoulders up towards your ears. Take a deep breath in. Hold it. And then I want you to exhale, releasing all the tension in your shoulders. Raise those shoulders up towards your ears. Take a deep breath in. Hold it. Exhale and relax all the tension in your shoulders. And one last time, let's raise those shoulders up towards your ears. Hold it. Exhale and release all the tension in your shoulder. All right, our last muscle group is going to be the fists. So I want everyone to make a fist. Squeeze your fists together. Generate some tension. Take a deep breath in. Hold it. And then when you exhale, I want you to release your fist. So exhale, release your fists and all the muscles in your body. Okay, let's make a fist. Deep breath in. Hold those fists tight. And then exhale, releasing all the tension in your body. One more time. Let's make a fist. Squeeze it tight. Take a deep breath in. Hold it. And exhale, releasing all the tension in your body. All right, let's finish with 3 more deep breaths. So let's breathe in through your nose. A long exhale out through your mouth. Again, deep breath in through the nose. A long breath out through the mouth, releasing all the tension in your body. And one last time, deep breath in through the nose. And long exhale out through the mouth, releasing all the muscle tension in your body. And when you're ready, you could slowly open your eyes. So that was a progressive muscle relaxation exercise. And these progressive muscle relaxation exercises are great for headaches. They've been shown in the literature to reduce frequency and intensity of headaches, especially migraines. You could do this. It's really quick. It takes 5 minutes. You could do it at any time. Before we wrap up, I just wanted to say thanks for spending this time with me. If you found this episode helpful, be sure to follow and subscribe to the podcast so you don't miss future episodes, and feel free to share it with a friend or family member who may be dealing with headaches too. You could also check out dynamicsportspt.com for any physical therapy if you're in New York City. Thanks again for listening, and tune in next week.